In general term, visual impairment can refers to the impairment of the sense of sight, that is low vision or total loss of sight. Multiple disabilities refers to a combination of various disabilities occurring together that may include visual, hearing, speech, physical, learning, intellectual disability, brain injury, cerebral palsy, autism, learning disability and possible others. In this chapter, the terminologists used visual impairment with multiple disabilities, that is VIMD, refers to persons who have more than one disability, with one of the disabilities essentially being vision impairment. The term multiple disabilities is frequently used to describe a child who has more than one condition that affects learning and development. Each child with visual impairment with multiple disabilities is unique. Each child has her or his own temperament and her or his own set of experiences and may be affected in different ways by a medical condition or physical disability. This makes it almost impossible to predict how much any child will learn and what he or she will be able to do as an adult. For parents of children with visually impaired with multiple disabilities, facing this uncertainty may be the greatest challenge. It would be very difficult for the doctor, educator or therapist to predict what to expect for the future and coordinating information and experiences from many sources. Any of the visual conditions as described earlier can occur as comorbidities with other disabilities. However, several visual conditions almost always occur as comorbidity of additional disabilities. In spite of several studies explaining the comorbidity, its understanding still remains unclear due to multiple pathway involves. CVI is caused by an abnormality in the brain. The eyeball and other optical structures are often normal, but for some reason the brain has difficulty processing and interpreting visual information. The damage that causes the visual impairment may result from loss of oxygen to the brain, bleeding in the brain or other type of trauma. The same injury to the brain may also result in cerebral palsy, intellectual disability, seizures or language or speech difficulties. Children with CVI may behave in puzzling ways. Their vision may seem to change at different times of the day. They may seem to stare straight ahead or through things, and they may seem to use vision to confirm information discovered through other senses rather than as their primary sense. Many children with this condition pay more attention to colorful or moving objects. In this condition, affect the optic nerve, the bundle of fibers that transmits signals from the retina to the brain. In optic nerve atrophy, the optic nerve has been damaged in some way. In optic nerve hypoplasia, the nerve has not developed. This may mean that the child may be blind depending on how much of the optic nerve is intact. Children with optic nerve hypoplasia may have other disabilities such as cerebral palsy or growth problems, since the optic nerve located close to the pituitary gland. Some children with optic atrophy or hypoplasia have a loss of peripheral vision and can only see objects that are straight ahead to them. Others lost central vision and may notice objects to the sides more easily. Various other conditions can also affect both the brain and the visual system. Cytomegalovirus is a common virus that can damage a child's brain before birth, resulting in such disabilities as intellectual disabilities, hearing impairment and visual impairment. Toxoplasmosis is a parasite commonly transmitted by cats which can invade the brain and eyes. The resulting brain damage can cause intellectual disability, seizure, cerebral palsy and visual impairment alone or in a combination. Rubella or German measles can affect the developing fetus if the mother has a illness early in her pregnancy. A very common cause of visual and multiple disability is a loss of oxygen to the brain, that is anoxia, either during delivery or as a result of an accident later in childhood. Loss of oxygen can lead to brain damage and a wide variety of disabilities, including learning disabilities, intellectual disabilities, cerebral palsy and visual impairment. The vision loss caused by these conditions can range from a mild impairment to complete blindness. However, children with visual impairment with brain damage may seem to use their vision differently at different times of the day. In addition, these children often have trouble with the perceptual responses such as perceiving depth, remembering visual information, reaching for objects they see and identifying important visual information. Several disabilities frequently occur with visual impairments. They include intellectual disabilities, cerebral palsy, spina bifida, physical impairments resulting from trauma, speech and communication disorders and hearing impairments. In combination with the visual difference, these following comorbidities can affect the rate or characteristics of child's development. Is a type of disability that results from limited mental capacity. The cause of intellectual disability includes genetics, brain injury and certain medical condition. There is no treatment for intellectual disability as it is not a disorder. Children with intellectual disabilities usually develop slowly than their peers. Limited mental capacity makes learning very difficult. Therefore, learning new information and skill is challenging. Children with intellectual disability have trouble grasping complex and abstract concepts. In this condition, children fails to meet expected developmental milestones in several areas of intellectual functioning and applies to individuals who are unable to undergo systematic assessments of intellectual functioning. A child with a visual impairment with multiple disabilities often have difficulties comprehending what others are talking about, awareness of reference the objects, events, people to be talked about. If the child also has cognitive delay, figuring out the relationship between words and objects or events become still harder. Echolalia means the word for word repetition of other speech is another communication problem common to children with visual impairments with multiple disabilities and especially those with neurodevelopmental disorders. Children with visual impairments are likely to use echolalia for a longer period of time than other children. This can range from meaningless repetition in which a child repeats the words but does not understand them to the meaningful use of echolalia is an interactive situation. Speech impairment may be attributed to a motor disorder such as cerebral palsy, neurological signs as well as distinctive features of voice, differentiated dysarthria from speech sound disorder. Limited use of speech may be a sign of selective mutism, an anxiety disorder that is characterized by a lack of speech in one or more contexts or settings. Selective mutism may develop in children with a speech disorder because of embarrassment about their impairments, but many children with selective mutism exhibit normal speech in safe setting such as at home or with close friends. Disturbances in the normal fluency and time patterning of speech that are inappropriate for the child's age and language skills persist over time and are characterized by frequent and marked occurrences. Is characterized by a primary difficulty with pragmatics or the social use of language and communication as manifested by deficits in understanding and following social rules of verbal and non-verbal communication in naturalistic context, changing language according to the need of the listener or situation and following rules for conversations and storytelling. The deficit in social communication result in functional limitations in effective communication, social participation, development of social relationships, academic achievement or occupational performances. Autism is a neurodevelopmental disorder characterized by impaired social interaction, verbal and non-verbal communication, and restricted and repetitive behavior. The term spectrum is autism spectrum disorder refers to the wide range of symptoms and severity. It results from a large survey of 75,000 children suggests an increased risk of ADHD among children with vision problems that are not correctable with the glasses or contacts, such as color blindness or lazy eye relative to other children. This finding suggests that children with vision impairment should be monitored for signs and symptoms of ADHD so that this dual impairment of vision and attention can best be addressed. CP is the name for a variety of disorders that affect a child's motor abilities, including movement, balance and posture. The condition is due to some damage to the brain or form in injury to the brain before birth, during birth or after the birth. The child with cerebral palsy may have involuntary movements or high or low tone in her head, trunk, arms and legs. Some children with cerebral palsy have a cortical visual impairment. Approximately 50% of children with cerebral palsy have difficulty in controlling muscles of the eyes, and this result in strabismus. This condition has misaligned eyes, showing one or both eyes turned inward or outward. Children with spina bifida may be unable to walk or experience sensation, often in the lower part of the body. They often have the optic nerve atrophy or a cortical visual impairment. A condition in which a person may have a combination of hearing and visual impairments causing severe communication, developmental and educational needs, and include moderate to profound hearing loss and significant visual impairment. Moderate to profound hearing loss and significant visual impairments with other disabilities. Central processing problems of vision and hearing. Progressive sensory impairments including hearing and visual impairment, and possible loss of auditory and visual processing disorder. It is associated with a severe physical or a cognitive conditions and a severe communication delay. Auditory processing disorder. When children have severe developmental problems, in addition to congenital deaf blindness, they are known to have a multisensory impairment. Many of these children will also have a wide range of other disabling conditions such as learning difficulties, epilepsy, feeding problems and severe disabilities. This term is widely used to reflect that a child with MSI has very complex educational and developmental needs, particularly relating to the use of remaining senses. Along with vision and hearing issues, they also encounter difficulties with other senses like tactile, olfactory, gustatory, vestibular and proprioceptive. The term MSI is a functional description rather than a medical one. There are a number of comorbidities that has been seen among the children with visual impairment with multiple disabilities in various degrees other than mentioned: learning disability, slow learner, borderline intelligence, locomotor disabilities, mental illness. Medical implications. A variety of medical problems may accompany severe disabilities. Examples include seizures, sensory loss and hydrocephalus. These conditions should be considered when establishing school services. A multidisciplinary team consisting of the students, parents, educational specialists and medical specialists in the area in which the individual demonstrates problem should work together to plan and coordinate necessary services. Etiological aspects are usually seen in visual impairment, children with multiple disabilities. Understanding of etiology will help the students to understand possible condition and effect on the child. Visual impairment with multiple disabilities is a result of infection, genetic syndrome or birth defect, trauma or accident, aging or progressive infection. Almost 50% of impairments have a genetic cause and influenced by consanguinity. It may be autosomal dominant, autosomal recessive and sporadic inheritance. Charge association or syndrome is an acronym referring to children with a specific pattern of birth defects. The acronym is C for coloboma, H for heart defects, A for atresia of Kone, R for retardation of growth and development, G for genitourinary problems and E for ear abnormalities. Down syndrome is a congenital defect caused by a chromosomal abnormality caused by the presence of all or part of an extra 21st chromosome. The affected individual has 3 chromosomes, trisomy, instead of the normal 2 for the pair at 21st chromosome. However, when some of the cells in the body are normal and other cells have a trisomy 21st, it is called mosaic. It is a congenital birth defect which involves deformities of the face. It usually affects one side of the face. Characteristic features of this syndrome include a partially formed or totally absent ear. The chin may be closer to the affected ear. One corner of the mouth may be higher than the other. Begin growths of the eye. Absence of eye. Golden hair is also known as oculoacicular dysplasia or OAV. Is transmitted in families by autosomal recessive inheritance, which requires the presence of 2 copies of Usher gene for the disorder to be manifested. Each parent of a boy or a girl with Usher syndrome is a carrier with one standard and one mutated Usher gene, but no sign of the syndrome. A child with the syndrome has it because he or she received 2 mutated Usher genes, one from each of the carrier parents. It also known as German measles, causes a group of congenital defects known as a congenital rubella syndrome, that is CRS. The disease is easily transmitted from the pregnant mother to the unborn fetus. A pregnant woman who is not immunized normally contracts rubella through the nose and throat. The infection spreads, transmitting the virus to the fetus across the placement barrier. Once the fetus is exposed to the virus, the cells of developing eyes, ears, central nervous system and heart can be damaged. CRS occurs among at least 25% of infants born to women who had rubella during the first 3 months of pregnancy. Infection of the pregnant woman can result in a miscarriage, stillbirth or the birth of an infant with abnormalities which may involve multiple organ system. This is a potential prenatal cause of multiple disabilities. It is commonly occurring virus that belongs to the herpes virus group. If a pregnant woman contacts CMV, the virus may be passed on to the developing fetus. Prenatal diagnosis is not possible and there is no vaccine. Problems resulting from congenital CMV include hearing impairment, vision impairment, jaundice, enlargement of the liver and spasticity. herpes simplex virus infects the face and mouth. Oral herpes is the most common form of infection. Other disorders leading to encephalitis are also caused by herpes virus. Meningitis is an infection of the membranes surrounding the brain and spinal cord caused by many different viruses and bacteria. It can cause impairment at any time in life. Depending on strain, and meningitis can lead to serious long-term consequences such as deafness, epilepsy, hydrocephalus and cognitive deficit, especially if not treated quickly. Birth between 24 to 37 weeks of gestation is considered as premature birth. Multiple problems and complications which may also lead to visual impairment with multiple disabilities. Low birth weight is a weight of less than 2500 grams. It means 5 pounds 8 ounce. At the time of birth, it is usually associated with premature birth. The term anoxia means a total decrease in the level of oxygen. It is a condition that occurs when oxygen is not being delivered to a part of body. If the condition does not involve total oxygen deprivation, it is often called hypoxia. Child can experience lack of oxygen due to various reasons like the cord around neck, which can lead to respiratory distress causing asphyxia or anoxia, resulting in brain damage, seizure, myoclonic jerk and neck stiffness. Trauma during pregnancy can injure fetus in the mother's womb. This can also lead to premature birth and or bleeding. Emotional trauma too can affect development of fetus. Brain injury during delivery or falling of the child after birth can cause severe disabilities. This trauma can also be due to improper use of forceps. Birth injury is damage sustained during the birthing process, usually occurring during transit through the birth canal. During the prenatal period, baby is completely dependent upon the mother for its nutritional needs. This is the most important time of an individual's life as far as nutrition is concerned. This time of rapid growth and development of the baby determines whether or not the child has met the developmental potential, and not only as a baby but for the rest of his or her life. Poor nutrition and unbalanced diet during pregnancy can cause low birth weight or premature birth. Infants who survive these conditions are more likely to have mental retardation, cerebral palsy, epilepsy and respiratory diseases which may result in deaf blindness or MSI or multiple disabilities. RH incompatibility is a condition which develops when there is a difference in RH blood type between that of the pregnant mother and that of the fetus. In such cases, the mother's immune system treats the RH positive fetal cells as if they were a foreign substance and makes antibiotics against the fetal blood cells. These anti-RH antibodies may cross the placenta into the fetus, where they destroy the fetus circulating red blood cells. Rh disease can result in severe anemia, jaundice, brain damage and heart failure in a newborn. In extreme cases, it can cause the death of the fetus because too many red blood cells have been depleted. Epileptic attacks and convulsions cause a risk of maternal and fetal hypoxia as well as increasing the fetal heart rate. During labor and delivery, there is also the risk of premature labor in the epileptic mother. Epileptic attacks and convulsions cause a risk of maternal and fetal hypoxia as well as increasing the fetal heart rate. During labor and delivery, there is also a risk of premature labor in the epileptic mother. In epilepsy, the normal pattern of neoneural activity becomes disturbed, causing strange sensations, emotions and behavior or sometimes convulsions, muscle spasms and loss of consciousness. This abnormal signal sometimes destroy the brain cells. Addictive drugs used during pregnancy place the baby's life at risk. The drugs may cause brain damage, bleeding, stillbirths and premature delivery are few of the additional complications that can result from the use of narcotics during pregnancy. Thank you.